scams. So, once again, I'm Dr. Melvin Fussell, board certified urologist for over 20 years. All right. And what we're going to talk about today is testosterone scams. Understand this. This conversation is strictly for educational purposes. Why do I say that? Because I'm not your doctor. All right. You don't, if you're not coming to see me, I'm not your actual doctor. So it's not that I'm giving out medical advice here. What I'm doing is educational. And I want you to remind that if you're just joining us, please like and share. All right, because what we're trying to do is destigmatize this whole thing on about male enhancement. Understand here at Urohard for Men, we do male enhancement and we do erectile dysfunction. But because I'm a urologist, I touch on all these points that are really men problems. So men are always looking for somewhere to get information. I'm giving it to you right here. It's free. I'm a surgeon. I'm a urologist. So I'm a male doctor, and that's what I do. I've been taking out prostates and kidneys and doing kidney stones and all this other kind of stuff. But now with Your Heart for Men, we do two things. All right? We do male enhancement and we do erectile dysfunction. So today, let's jump into it. Testosterone scams. All right? According to social media, if you're tired, gaining weight, losing muscle, with struggle with libido, having troubles concentrating, and your team lost the football game, is probably low testosterone. And that's how they're advertising to you. That's what they're telling you. But today, we're separating testosterone facts from testosterone marketing because you guys need more facts so you can not get scammed. All right. So, my goal here today is to help men understand what testosterone actually does, how low T is diagnosed, which treatments are actually legitimate, and where marketing often crosses the line into just straight up misinformation. All right. So, watch this so you don't get really scammed. All right. Now, if you guys are out there, put a little chat, something in the chat. And here's the question: have you ever had your testosterone checked? You can say yes. You can say no. Thinking about it. Or I'm already on TRT, testosterone replacement therapy. And a lot of guys are. So, you need to listen. Here we go. So, here's my opening statement. And Lisa, let me know if they put it in the chat. Testosterone deficiency is real, but so is the industry built around convincing every man over 35 that he has it. Why age 35? Because that's when testosterone starts dropping off. And we see that a lot here in the United States. And we kind of touched on that. It's multifactorial for all the reasons that testosterone is dropping off. And we're seeing that. Now, if you want to get deeper into that, go back to one of my other videos where we talk about it. But we're going to go into what testosterone actually does. Yes, ma'am, Lisa, you got something to say?
Just some comments in the chats. Yes, thinking about it.
Oh, okay. So this talk is for you if you're thinking about testosterone replacement therapy, TRT. Now, let's talk about what's testosterone's role. What is it supposed to do? All right. It affects your libido, your erectile function, your energy, your mood, your muscle mass, your strength, your bone density, and your red blood cell production. Testosterone is the male hormone, all right? Just like women have estrogen, we have testosterone. And that's the role testosterone is supposed to now do. What I talked about was that's the role of testosterone. That's what it's supposed to do. But the common symptoms that we see in low T are decreased sex drive, all right? Reduced morning erections. It just ain't waking up with that pee heart that I was used to getting. Fatigue. I get home in the evenings and I'm just worn out, man. I'm on the couch, you know. Reduce motivation, man. I'm not interested. I don't care what she does. I'm just not interested. Loss of muscle mass. I'm working out, trying to work out, really ain't got the energy, and man, I am just losing muscle. And increase body fat. That's that visceral fat that you're picking up and all this other kind of stuff. Those are common symptoms that we see with guys with low T. The important point is that many symptoms actually overlap. All right? So you get a little bit of this and you get a little bit of that. But they overlap with things like sleep apnea. All right? That's the guy that's snoring really hard at night. He snores like crazy. He's really not getting into that deep REM sleep. And that guy is waking up several times, so his body never rests. All right? Those are the guys who start having problems. Another one is guys that have diabetes. Diabetes is a silent killer. I stress, you gotta control your diabetes. It's gonna cause you so many different problems. And if your diabetes is out of control, you're gonna lose your erections. Things are just gonna happen. And if you don't make a change, then so many other. It's like a domino effect. Diabetes just causes this, that causes that, that causes that. Another thing is obesity. That's a guy out there. You eat and then you lay down. All right, so that's that guy that's having those kind of problems. Now, also, we see depression, stress, aging. All those go along with it. So symptoms alone don't diagnose low T. You can't just make a diagnosis of low T based on symptoms. All right. So, where was I? Now, refocus. So, the testosterone booster industry. All right, here's the hook. You walk into your supplement store. I'm talking about the GNCs, the vitamin places, and all this other kind of stuff. And you'll find shelves full of products promising to boost your testosterone naturally. I mean, it's tons of stuff out there. But I want to just talk about a few things that you commonly come across, like tribulus. All right, hopefully I'm saying that right. Tribulus. That's Tribulus. Is actually it's a plant whose fruit, leaves, and roots have been used in traditional medicine as a natural testosterone booster. The claim is that it actually increases your testosterone. The truth is, the reality is that there's little evidence that it significantly raises your testosterone. Not even if you're a healthy guy. So it's out there, but it's little evidence that it actually is increasing testosterone as a booster. Here's another one. Fenugreek. All right, that's Fenugreek. It's a herb whose seeds have been used in traditional medicine for thousands of years. So this has been around for a while. The claim is that it increases your libido and it improves your testosterone. But here's the reality. It may improve your libido in some men because what it does, it preserves your free testosterone. And we're going to get into the different testosterones out there because there's total, there's free. This actually is supposed to help out with your free testosterone, which is the active part. Although it's not a replacement for TRT. And the bottom line is that there's mixed results when it comes to that. So now let's talk about D-aspartic acid. All right. D-aspartic acid is a naturally occurring amino acid found in the brain. It's already there. It's in your tissue. It's in the pituitary gland, it's in the testes, and it's in other tissues, but it works as a signaling molecule. And it's thought that it will increase your LH and FSH. You guys know the pathway. You've heard me talk about it before. All right. In the anterior pituitary gland, you got LH and FSH, which are released that affects the testes, that causes more testosterone, and it feeds back loop. So, so basically, this says that, hey, it helps release more LH and FSH. Well, the claim is it will significantly increase your testosterone. And if it did all that, well, I would expect it to increase too. But the reality is that we see mixed results. And there's no significant increase in your total testosterone. So when you're taking D-aspartic acid, it, it's not really working across the board the same for everybody. All right, the next one, ashwagandha. All right, ashwagandha. All right, it is the best studied supplement with controlled trials showing modest benefits in some men, particularly those that have stress and fatigue. All right, or you got borderline testosterone. The claim is that it causes you to have higher testosterone. The reality is it may help with your stress, and you may get a small increase in your testosterone. What we've seen clinically with these studies on ashwagandha is maybe another 10 to 20% boost in your testosterone. But I can tell you, out of the ones that we've discussed, I would say ashwagandha is probably the better one out of the different ingredients that we see in most testosterone boosters. So there's a thumbs up for ashwagandha, but understand you're only going to get a 10 to 20% boost in your testosterone. And I can say that because it's been more studied than any other ingredients. So many of these supplements are better at increasing hope than actually increasing testosterone. And that's the take home point. So you got to realize which one of these supplements really work. All right. Now, here it is. We get the biggest testosterone marketing lies, because there are a lot of lies out there. Remember, this whole thing is talking about the scams. All right, lie number one. Here we go. Every man over 40 has low testosterone. And that's false. There's false. Because when we start talking about testosterone, it's a range out there from low to high, depending on what scale. You're in the 200s up to the 900s, depending on what scale. But here's the catch, is that they talk about, guys after age 35 dropping off. And that's what we see as a group. But that's not true for each individual. And when it does drop off, it's dropping off at 1 to 2%. So if you started up here and you're dropping off 1 2%, maybe you're declining at a slower slope than somebody else. So, you're not having problems in your 40s and 50s, maybe in your 60s. You're not as high as you were back, in your 30s. But the thing is that understand it does taper. But the thing is, everybody doesn't taper at the same rate. Lie number 2. Here we go. One lab tells the whole story. And that's what we run into with this, is that everybody thinks one lab tells the whole story. And the answer is false. Because if we want to know, and I'm going to tell you because I manage testosterone replacement, we want to know, what are your symptoms? What's your total testosterone? What's your free testosterone? What's your clinical picture? I got to put all that together to actually figure out if you truly are symptomatic, somebody who needs TRT. All right. So it's not just a one and done lab or one and done conversation. Lie number 3. Here we go. TRT fixes everything. All right. And that's how it's pushed out there, that it fixes everything. Get your TRT replacement and hey, you're going to be much better off. But understand this, that is false. TRT is not marriage counseling. All right. So if she's complaining, you need to look a little bit deeper than just TRT. It's not weight loss surgery. All right. And it's not a cure for poor lifestyle habits. So if you're out there, you're gaining weight, you're not controlling your diabetes and all this other kind of stuff, or if you got sleep apnea, you're not managing that, you're not wearing your CPAP because it's uncomfortable, and you don't want to, understand this. You're going to have problems down the road. Yeah, that CPAP just don't fit like I like it. Man, it's hard for me to sleep with that thing, so I just don't sleep with it. Understand this. You need it for a reason, and if you don't do something to help you out with your sleep apnea, then your body never rests, and you're going to start having problems with your testosterone level and ultimately with your erections, your blood pressure, all that kind of follows behind that. So, ladies, if your man snores, you know, like something out in the jungle, then yeah, you might need to have him checked because that dude is not resting. All right. Lie number four: natural testosterone boosters work as well as TRT. That is false. Those natural boosters don't work as well, but they are helpful. Remember, we talked about ashwagandha might get you a 10 to 20% increase, but that's not, you'll get more than that if you actually have testosterone replacement therapy. All right. So, what's the craziest? And this is a question for you guys. What's the craziest testosterone claim you ever seen online? Because there are a ton of them. All right. Now, you can throw that in the chat. And I'm going to answer your questions also. So, here's a point that we really need to talk about: online testosterone replacement therapy. These clinics, because there are a lot of clinics out there now. The question is it good? Is it bad? Or is it just ugly? Because there's so much out there. There's been a big boom in telemedicine as far as testosterone replacement therapy. Some clinics are actually excellent. There's some that actually do a good job, but then some are not. The question becomes, how can you tell if I'm going to somebody and I'm being seen for testosterone replacement therapy, TRT? How can I tell if they're really doing a good job for me? All right. Well, here's some of the green lights, the green flags. If they get comprehensive labs, all right? And you say, well, Dr. Fussell, okay, they drew some blood, but okay, get your pen and paper out. Let me just give you some idea of what comprehensive labs look like. They need to get a CBC. That's a complete blood count. They need a PSA. That's your prosthetic antigen. You need your LH and your FSH. You need your prolactin checked. You also need to check your total testosterone, that's all of it, and your free testosterone. And we want to know about sex hormone binding globulin. That's like a complete look. They need to check all of that to say, hey, should we actually, or does this guy really need testosterone replacement? Understand this: the CBC, we got to check your blood count because we need to check your red blood cell production. Remember, I told you that testosterone can thicken your blood. All right, so if it thickens your blood, it puts you at risk for heart attack, stroke. All right, those are two big things. It can also, we want to check your PSA because that's screening for prostate cancer, because it can also cause your prostate to get bigger. And if your prostate's getting bigger, is it getting bigger because you're blessed to be older? Or is it bigger because you're on TRT? Or is it getting bigger because you've developed prostate cancer? So we got to follow your PSAs. And we've talked about this before. Normal PSA is less than 4. So once you get above 4, then I get a little concerned about being on TRT because the risk goes up. LH, FSH, prolactin. That's all things that you got to check for the hormonal axis. Remember, we talked about the brain and the testicles actually communicating. So you need to know what those levels are. And finally, I need to know what your total testosterone is. I need to know what your free is. I need to know what your sex hormone binding globulin is. That way I can really tell if you really need testosterone replacement. Understand that testosterone can be kind of confusing. But let me just give you this example about understand that testosterone is like money. All right? Total testosterone is all the money that you have in your bank account. So when they draw your labs, you look at your total testosterone, that's all you got. That's your total. That's what's in your bank account. But then there's a lab called free testosterone. All right, that's the active part. Think about it as cash in your wallet that you may spend immediately. That's the money you got in your wallet. It's not in the bank. It's in my wallet. It's with me. I can spend it. It's active. So free testosterone is important. That's what tells you what you really got right now. And then testosterone actually tightly bonds to sex hormone binding globulin. It's like money in a long-term investment. You own it, but you can't use it right away. So that testosterone is tied up. I can't get to that at this time. So that's why it's important to look at these labs to say, okay, do I really need to be on testosterone replacement? Now, because we're trying to figure out if this online clinic is really good. We talked about the comprehensive labs, but they also got to do a medical evaluation. All right. You need follow up monitoring. They got to check your labs at least once every 3 months. Why? Because I want to know if your CBC is going up, your hemoglobin hematocrit, is your blood getting too thick? You could be at risk for a stroke or a heart attack, because nobody's checking. So if you go into an online clinic or something like that and they're not checking your labs at any clinic every 3 months, then you might need to look for somewhere else to go because something's going to get missed. In addition to that, they need to discuss with you the risk. Understand the risk of testosterone replacement. What are they again? It can thicken your blood. And if it thickens your blood, that means it increases your risk of heart attack, stroke. All right. So you got to check your hemoglobin hematocrit levels. All right. In addition to that, it can increase your risk of prostate cancer because it can make that prostate bigger. Is it getting bigger just because you're blessed to be older, or is it getting bigger because of prostate cancer from the influence from testosterone? Like I'm feeding the fire because I'm dumping testosterone on it. So the red flags, because those are some of the green flags. The red flag is if they're prescribing after one questionnaire, they just give you a couple of questions. They're like, sure, right, that's a money grab. All right, they didn't even check your labs. Okay, something's going on here. They guarantee you approval that you're going to get testosterone because you may go to a doctor and they say you don't need it. But this place says, I guarantee you. Oh, that's a money grab. Everybody qualifies. Okay. All right. So if you're starting to hear that kind of stuff from these testosterone clinics, then you really may not be a good candidate. And or the thing is that it's more of a money grab than actually helping you out with your replacement. So be careful because they will feed you a line, but you got to know what to look for. That's why I just talked about the green flags and the red flags. So good medicine isn't about selling testosterone. It's about figuring out whether you actually need it. And that's the case. Do I actually need it? Because a lot of guys say, man, I need to get my testosterone checked. Okay, that's cool. But the question is, do you actually need replacement? And you got to look at those labs. And the main three labs that you got to look at is total testosterone, free testosterone, and sex hormone binding globulin. So I got to look at those and say, yeah, I agree. You got hypogonadism. Then the question becomes, meaning hypogonads, those are the gonads. Think they're hypo, that means it's low. My gonads ain't putting out because they're the ones that are making testosterone. So the thing is now you got hypogonadism. The question becomes, is it primarily coming from my testicles or is it coming from the signaling from the brain? Primary versus secondary hypogonadism. That's how that whole thing works. I just broke that down for you. Write it down. All right. So, Lisa, any questions yet? Because I'm going into another segment. Okay. All right.
No questions.
she's getting through the technical part of that new microphone.
Okay,
What?
here's a question.
Okay. Question.
Did he tell us what testosterone boosters work?
Yes, I did talk about which testosterone boosters work, and I told you that ashwagandha probably works better than most of the other ones that are out there because it's been better clinically studied. You can get a 10 to 20% increase in your testosterone from taking ashwagandha. It's also going to help you out with your stress level and your fatigue. So it does some other stuff out there, but ashwagandha out of the ones I discussed is works pretty well. But it's not a replacement for actual testosterone replacement. You might get a little boost, 10 to 20%, but it's not like what you're going to get if you actually need testosterone replacement. All right. Hope I answered that question. Was there anything else before we go into this next? So let's talk about what men should check before blaming it on low T. All right. You need to check how well you're sleeping, your sleep quality, especially if you have sleep apnea. And if you got a sleep apnea and you wear a mask, then make sure your CPAP doesn't leak. All right. Or if you're somebody who has sleep apnea, but you just don't wear the mask because you're like, that thing is irritating, then you got to go find something that you can wear because otherwise you're obstructing. That's why you're snoring, because there's obstructive sleep apnea. There's, other types of sleep apnea, intrinsic. So you gotta figure out what's going on. You need some help. All right. You can't just say I ain't doing it. And there are a lot of guys that got CPAP at home and they're not wearing it. All right. Another thing is weight. Understand this. If you're overweight, obesity can actually lower your testosterone. So if you're a heavy fella and you carry a lot of weight, then understand that weight is working against you. So working out works in your favor. Alcohol. If you're a heavy drinker, it can negatively affect your hormone production because you drink too much. Remember, do everything in moderation. Even the Word of God says that. Do everything in moderation. So yeah, you can have a drink, but you need to be moderate about it. If you're always the one that's drunk and they always got to say something to you, that's a problem. You need to listen up. Diabetes. Poor glucose control impacts hormones and sexual function. If you're a diabetic, all right, you need to know what your A1C is. You got to control this. It's on you. And you say, well, my doctor just ain't doing nothing for me. Get another doctor. But the thing is that understand this. If you're a diabetic and you're not controlling what's going on, then you're on the train track. And what's down that track is erectile dysfunction, loss of body parts like toes, kidney failure, liver failure, strokes, and finally death. All because you didn't try to do anything to control your diabetes. Stress. Chronic cortisol elevation affects testosterone. Guys, if you're under a lot of stress all the time, then yes, it can affect your erections because it's going to affect your testosterone level, whatever, because you're constantly under stress. All right. I actually talked about the supplement ashwagandha. It helps out with stress, so maybe you might want to get on some ashwagandha to help out with that in addition to. All right. So here's my talking point. Sometimes the answer isn't more testosterone. Sometimes it's fixing the things that are suppressing your testosterone. All right, Lisa, what's the question?
Does DHEA work for testosterone?
Does DHEA work for testosterone? Yeah, and we're gonna get more into DHEA and stuff like that. That's gonna be a much deeper conversation. So I'm gonna come back to that. But the answer is DHEA can help out. All right. So who is actually a good candidate for a TRT replacement? All right. So the typical candidates that we see out there are symptoms, have the symptoms are present. And we talked about the symptoms. Consistently low labs. I mean, your labs are always low. And then you need the appropriate evaluation was completed. What patients should understand is that TRT, testosterone replacement therapy, may improve your libido, your energy, your mood, your body composition. All right. What it doesn't do, is it doesn't save your relationship. It doesn't eliminate all of your fatigue. All right. And it doesn't turn a 55-year-old guy into a 25-year-old guy. So testosterone is only gonna be do so much. So the good candidates have realistic expectations, and you need to be realistic about what is TRT replacement gonna do for me. So here's some myth busters. All right, all testosterone, all fatigue, all if I'm tired all the time, must be my testosterone. And that's false. You could just not be getting enough sleep. You could just have a lot of other stuff going on. That's why you're tired all the time. All right? It's not always your testosterone, but it's nothing wrong with getting a check. Here's another myth: every man should be on TRT. And that's false. Everybody doesn't need it. And that's why you need to get your labs checked, along as looking at symptoms and all this other kind of stuff, because we want to make sure that, hey, you really need it. All right. Myth: testosterone boosters work like prescription TRT. And we went over that. Those boosters, some of them work well or work okay. Some of them don't really work at all because there's been nothing that really showed that they made an impact, even though they've been around for traditionally through traditional medicine for years and years. But the thing is that out of the ones that we discussed today, ashwagandha probably helps out more than most of them. All right. Myth: sleep apnea can affect testosterone. Well, that's actually true. If you got sleep apnea out there, then yes, it can affect your testosterone. Then, here's another one: low testosterone should be diagnosed with symptoms and labs. That is actually true because we need to check your symptoms, we need to check your labs. It needs to be more of a holistic approach. It can't just be, I'm just checking, a couple of things, and or you just gonna put you on. You gotta see if it's really needed. So I'm getting to my final take home message here. All right. Low testosterone is real, guys. It's out there. All right. But so is marketing. That marketing machine that profits from convincing men they have to have it. So these testosterone clinics have just taken off and guys are flocking to it. The question is, are you really getting the help that you need? So don't let those Facebook ads or social media out there diagnose your hormones. You need to get the facts. You need to get labs. You need to make a decision based on evidence. That's how you can really make a difference for yourself. It's not as simple as they make it seem. So, actually, I'm coming to the end of this talk about these testosterone schemes. I know they probably got a couple of questions out there, and let's see what you got to say.
Which ashwagandha do you prefer, gummies or capsules? And do you have a preferred brand?
Actually, guys, I don't have a preferred brand out there. And I've kind of looked into this whole thing with gummies versus capsules. And, what I'm seeing is that, what it really comes down to is whatever you decide to take, try to do a little research and see if they've had some third party testing. So a third party out there check to say, yes, this actually does what it says it's going to do. There are some brands out there that seem to be better than others, but I'm not promoting any of those. So you got to do your research to see if you're really getting one. And then, go ask if it's third party tested. If you can't find it on their website, go out there and ask AI, Google it, and see if that company is third party tested. Otherwise, they're just shooting you some stuff. Was there another question? Okay. All right. So now, guys, basically what it comes down to is we talked about these testosterone scams. Why would we need to have this discussion? Because there are three things you need to get a good erection. You need to have good blood flow, good nerves, and desire. Desire is the testosterone component. It's not as strong as component as blood flow because we know blood flow is especially important. And a lot of times, what the real problem is a blood flow problem. You got plenty of desire, but you don't have any blood flow. All right. But for those guys who do have concerns about their testosterone levels, go get checked. It's best if it's drawn in the morning because it has what's called a diurnal rhythm, all right, where it drops off further in the evening. So most of your insurance companies want you to get your testosterone checked early in the morning. Try maybe before 10 o'clock or something like that, so you can see what that early morning levels are like. And then after that, in the evenings, it kind of drops off. So, just think about it. When is the best time to check it? Well, it's best time to check is in the morning. That's when I have that pee hard on. I woke up. Might as well go get my testosterone checked. Now, Lisa, if we're going to have any questions,
It's a couple of questions. One says, if I have diabetes with no erections, will pills work?
the question is, if I have diabetes with no erections, will pills work? That's a long answer. And I'm trying to give you a short answer. Is it depends on how bad and how much damage diabetes has done to your tissue. All right, because it's damaging your tissue from having diabetes because it affects blood flow. Now the question becomes, how severe is the damage? Can the pill still work for me? Because some diabetics, early on the pills still work. But if you're a diabetic and you're to the point where, hey, they're talking about, taking off a toe or whatever, then you're having some vascular problems. Why? Because the penis has got some of the smallest vessels in the body. So you're gonna have problems with the penis. It's your barometer before you even have problems with your toe. All right, that was a short answer. I can go much deeper than that, but that's the short answer.
The next one's a statement. It says, my doctor says my testosterone is normal at 400. I'm 47 years old.
Okay, so your testosterone is 400. That's a normal number, and that's great. Then what it comes down to is also looking at what's your free testosterone, what does your sex hormone binding globulin looks like, and then the thing is, but most guys in their 400s are fine. All right, so once they looked at it, but you got to look at the whole picture to see, and then also talk to the guy about his symptoms because he could actually have a high testosterone level. But then the thing about it is that he's got he doesn't have a lot of free, and you got to figure out why. What's the next question? All right. So the thing is that guys, until next time, I want you to keep those horns up.